Hello everyone, let's try to solve this question together. So this ECG is obtained on a newborn infant with a history of fetal arrhythmia. The findings are consistent with, pause the slide, zoom the picture. Okay, the correct response here is C, which is premature atrial conduction. And if you see that, like here, it's very evident, if you guys can follow with me, that the beats are happening 1, 2, 3, 4, and then suddenly you see that there is no conduction. And then again you see beat coming, and then you see again, you see all this, these are premature atrial contractions. So what do you guys think? Others are wrong. So let's do A, first degree heart block. If you see, all the PR interval are normal, and you guys remember that in heart block the PR interval is increased, so that's why this is not the right choice. What about left axis deviation? So look at lead 1. Lead 1 is negative. Here you can see that, and AVF is positive. So you know that whenever lead 1 is negative, it's a right axis deviation. Easy way to remember, if both leads 1 and AVF are negative, then it's extreme axis. If both are positive, it's normal axis. If 1 is negative and F is positive, in this case that is right axis deviation. If 1 is up and AVF is down, which is negative, then it is the right axis deviation. So I hope and the best way, I'll show you, the best way is to remember this. Like, again, to reiterate, if both are positive, it's normal. If both are negative, it's extreme. And like the case seen here, if lead 1 is negative, it's right axis deviation, and if lead 1 is positive, it's left axis deviation. Anyway, easy to remember. In neonates, most of the time it's right axis deviation, so you will have negative V1. So the easy way to look at axis deviation, always look at lead 1. If it's negative, then go and look for AVF. If AVF is positive, you know that this is right axis deviation. If AVF is negative, then you know it's an extreme axis deviation. So you will be dealing with this most of the time in ECGs, so in neonates. So that's why second one is out. What about sinus bradycardia? So we all know that you can easily see one large box, which is 300. We can see the second large box, which is 150, and we can see half of it. So definitely this baby has a heart rate around 100, you can see. And how we know that? If you remember, these are the boxes. See, 300 for the large box, then 150 for 2, then when you have 3. So this baby has slightly less than like about 3.5, something like that. So if you see again, let's see I want to see the one which is falling right at there. So let's just start here. So 1, 2, 3, somewhere there. So, and this is the final reading by the cardiologist, that this is the normal sinus rhythm, and the heartbeats are, like we said, around 100 with the 96, and the premature atrial contraction are not conducted, as you guys can see here, and then some aberrantly conducted, which you see here. So I hope you find this presentation interesting, and again, if you did like the video, please do subscribe the channel, and you guys have a wonderful day. Bye.